When people come in from a rough day or a rough week, it's a good place to start. There's a lot of safety in feeling this way because they're just exposing their back and not the delicate underbelly. So you might want to consider starting with the back, although some people do start face up. So remember, we start here by just checking the tension of the shoulders. You want to give yourself a little bit of an idea of how the muscles feel before and after your work. So we'll start up here at the neck and get the thumbs going in different directions here. There's a bit of tension. And there's some crepitus. The crepitus has this crunchy kind of feeling, and it also sometimes sounds a little crunchy. But you want to bring those thumbs down along the trapezius into the shoulder blades. There's a lot of roughness in here, but you can also see how you're bouncing over the trapezius there. So don't mistakenly think that there's something going on with the muscle when you're actually falling off of the side of the muscle there. That's why it's important to know where those superficial muscles are. And then we'll just go down the spine on either side of the spine without a whole lot of pressure, but enough to feel the separation of the tissue. Back down again. And up. I like to work in threes for some reason. Now another way you can come back up the back is after your thumbs get down to the sacrum, the SI joint area. You can spread those thumbs across the hips and then bring your fingers back across them and bring your fingers upward on the spine. So there's another little thing you can do to make a little bit of variation to the work. And then making a broad sweep of the back using effleurage and a little thumb iron. Okay, and then I'm coming back up. It's nice to relax along the vertebrae before you get started into the rest of the muscles. Now we're going to start up here at the shoulders, pulling that muscle outward toward the shoulder blade. Moving your fingers little tiny spaces so that you're getting the entire muscle. And again, the pressure is enough to not feel any pushback. And then circular motion from the tip of the trapezius, staying on that trapezius muscle. There's the edge. Up into where it's attaching along the shoulder blade. And up. Okay, now moving up to the shoulder and going the opposite direction, pushing upward, thumb iron, upward into the neck. It's important to go as much to origin to insertion as possible, or insertion to origin, depending on where you are. You want to get the whole length of the muscle. It feels very incomplete when you stop halfway, so try to get as close to those attachment points as possible. Make the work much more thorough. And then you can knead the muscle around after you get it lengthened and stretched and softened. Going into the shoulder blade is here. There's muscles on top of it. And to just work along the muscle, back and forth along the shoulder blade. Taking that up. There's a muscle here attached to the shoulder blade up to the neck, which is the Levator Scapulae muscle, and it's usually very tight. the tighter it gets, the more it'll pull those shoulders upward, so we start to carry our shoulders real high on the body rather than letting them relax on the rib cage or just above the rib cage, more in a floating position. Remember to go into the muscle slowly and softly, and you'll be able to find your way deeper into the muscle. It opens up, it'll soften and open up. You always want to be invited into the tissues. You don't want to force your way in. When you force your way in by pushing too hard, too quick, or applying too much pressure, the body is going to have a response to that. Now here we're picking up the shoulder blade, and I like to use a little shaking. And I pick it up from the shoulder itself. My right hand is underneath her shoulder and lifting it up. You can see how it will lift, especially if you guide it from the back. Now, not everybody has this big of a winging that happens, because sometimes the muscles are very developed, but you can still get in pretty good. Sometimes you're only going about that deep, but you can still work the muscle in the same way and soften it, and oftentimes it'll bring you deeper in. Now, as you come up, it's more open toward the bottom, and then as you come up the shoulder blade, you're going to find that you're going to be guided more toward the edge of the shoulder blade and picking up. So don't feel like you have to force your way through that deep if you're getting in deeper through there. Follow the anatomy on that. I will make a note that sometimes people will lift the shoulder by putting this behind the back, which does lift it up, but this oftentimes brings up stuff emotionally with people, like being bound, and sometimes people don't have the stretch in the front of the arm to be able to do that comfortably. So I choose to not risk that and just lift it up from the shoulder underneath, because you can get the same result. In fact, it's even a little bit better because you can direct it. You can even tuck it in and direct it a little more. So that's a little information about the shoulder blade. So now what I like to do is just bring my hands down in a long effleurage thing motion down to the hip crest, the hip edge in the SI area, and work along the attachment points there. Sometimes you're going to feel bumps in there. Sometimes they're little tears. So be mindful of what it is you're feeling. If it's a tight muscle, it'll release. If it's a little tear in the tissue, it will feel kind of like a bubble. It's not anything dangerous, but it's a different feeling. Then I run my fingers, my thumbs, up the side of the vertebrae, allowing the thumbs to press in as deeply as the body is willing to let it go. And it does feel like the muscle just opens up. And then a little bit farther away from the spine, so there's 3 long thumb irons along the spine, and then the third one is on the edge of this erector muscle. And it's a little different when you get up to the shoulders. You'll wiggle around a little bit because there's other muscles that are in the way, but just keep following that. It goes deeper as you go higher, so know your anatomy and stay on it, even though you might not be actually palpating it. Then this is some little kneading coming from the spine, pulling it away from the vertebrae. Sometimes there's ticklishness in the area of the back. I don't really know what that is. And here we're coming into some tight muscle, but we're just going to keep working kind of underneath it. You're picking it up a little bit and pulling it, and then bringing that back down. and just sweeping back up. Okay. Then going to the other side, we're going to do the same thing. Checking that shoulder blade. Okay. Now we're going to do the same thing over here. Pull these muscles open. It's sort of a decompression of the tissues. It's a stretching of the muscles. Getting your fingers in there so that you can relax the tissue and help to soften it. Down we go, and you can see again how the trapezius comes into a V, working up in a little circular motion right along that trapezius muscle and up through the shoulder. Okay, then moving upward, you're going to come in the long way. And my body is out of alignment here in order to be able to show you. But be sure that you place your body properly so that you don't wear it out. Because it's important for the therapist to have good body alignment and good ways of working with your body as a therapist into the different angles and directions that you're moving. You want to be ergonomically correct. And down we go. And just up there softening more. I can already feel where the muscles are softened. This is where there's quite a bit of crepitus. And it's right at the levator scapula muscle. That muscle is usually the one that'll hold this. That muscle really does hold a lot of tension as a general rule. And we'll go across the shoulder blade, just across the blade itself, feeling the muscles. Okay, now here's how you get underneath. Picking up the hand, or the shoulder, slipping the hand underneath, and then just bringing it up. And here we are again into the winging of the scapula. Getting underneath there. Okay, you can sometimes come in from the other side as well. Get under the side where the armpit is more. You can get under that way. You can also, from this position, you can rotate the shoulder blade around. But be very careful when you do. If you feel any kind of tension or pull, you might be doing something that the body's not ready to do or not wanting to do. It might be stiff or something. So any kind of range of motion, go carefully into it. Okay. I think I took this out of sequence because I'm in such an odd position, but don't forget to also run the muscle up this direction. And it doesn't matter if you really go out of sequence, but it is important to try to do the same thing on each side. We're going to brush downward and do these little thumb irons, just short little strokes to check out the attachment here. Sometimes the low back is very tight. And then the thumbs are going to run up. Close to the spine, then in the middle of that muscle. When you first start out doing this, it's better to go slower at it than fast. After a while, your hands get to where they know how to work that muscle in a way where there's a little more speed that can come with it, and you still get the job done thoroughly. But at first, it's important to go slowly because you're going to feel a lot of things opening up and releasing, or you might run into a barrier somewhere. It's going to teach you a lot, but if you speed through it too quickly, you're going to miss a lot of things, and the understanding that you gain over time won't be quite as complete. Okay. Okay, I'm going to go back to the other side, although normally I would work from that same side. And this is where I work along the vertebrae with 2 fingers, starting up at the neck, right at the very base of the neck, base of the skull, the top of the neck. And here you want to be careful not to pull hair. So you're going to start your fingers in, you're on either side of the vertebrae, and you want to vibrate it down a little back and forth, or kind of a vibration like that, or just even a back and forth, kind of a combination. It's not an easy one to do. It's one that you'll have to work yourself into. And then what I like to do here is take my thumbs right along the vertebrae and pick up the muscle. Now we kind of picked it up before, but we came from a different angle. This time I'm across the body, picking up the opposite side of the vertebrae, and it's kind of a roll with the thumb. Rolling. Rolling. Up we go. And then do an iron back down right along the spine, and I like to hold the top of the muscle here. It sort of feels like I'm just stretching it, but I do like to hold my hand there. And then the same thing on the other side, where you're rolling through right along the vertebrae. Don't get on top of the vertebrae, go alongside of it and roll that muscle open. There's a lot of little things down there. It feels good. And then coming back up, holding and just stretching down in that direction. Okay, then I come back here, and the erector spinae muscle is about this wide. So my hands go on either side, and I pick it up from the outside, pulling it upward and kneading it. I really like kneading the muscles all the way up. And then we're going to do the vibration again, starting up at the neck, vibrating down. Then this time coming up the spine, you're going to have your thumbs and you're going to be right next to the vertebrae. Now this is a little tricky, because what you're going to do is you're going to feel like you're pressing sort of downward and outward. So it's a downward kind of stretch outward, but it's not with a lot of pressure, because you want to open up that space, all those little attachments. So it's kind of a downward and outward feeling. And that takes time to develop that. This is where you start getting very proficient, is when you can do different things with your hands than just normal, more gross movements, when you start to get real refined. Okay, then going around the vertebrae one at a time. Now here you're going in between the vertebrae. It's just another thing that's it feels good, and the back is needing it. You're working along more the nerves are coming out. You're not on them or anything, but it's just, the back does so much work. The spine does a lot of work. It supports us, and it's important to have the muscles soft around there so we don't pull muscles and have little injuries here and there. Even though they're not very serious, they can create some discomfort in muscles over time. And then just taking it and wrapping away from the body. I like to go through and get in between the rib cage. Get in between come up on there. Going that way, and then also going through here. Now some of those shoulders are still a little tight. And this is where some of the other work that I do will loosen those muscles even more, because we have to get deeper into the nervous system for that. But it's going to relax people enough to where they feel much better. So, and over time it can loosen little by little. The body can't always do it all in one session, especially if there's been a lot of workload on it. And then going back, and the last of it is wrapping upward. It's just a nice way to finish. And then upward on this side, up into the neck, and then you can, once as you started, just finish that way, and the muscles feel different. And up we go, and there's the back. This is Athena Jezik. Thank you for watching.